CAISS Exam. Question 1. When assigning severity codes, should the coder use the physician's description of the injury or the ACE definition? Physician's description, ACE definition, whichever yields a higher score, whichever yields a lower score. The coder should use the ACE definition. Question 2. If the physician's OIS grading differs from the ACE definition of the injury, which should be used for coding? Physician's OIS grading, nursing notes, ACE definition, radiology report. The ACE definition should be used. Question 3. If no description is available for a solid organ injury other than the OIS grade, is it acceptable to use this information for assigning an ACE code? Yes, no, only for pediatric patients, only if confirmed by autopsy. Yes, it is acceptable. Question 4. In order to assign an ACE code with blood loss greater than 20%, you must know to what area of the body the blood loss is linked. True, false, only for penetrating trauma, only for blunt trauma. True, you must know to what area of the body the blood loss is linked. Question 5. Are dimensions of lesions used to determine injury severity? Yes, no, only in the extremities, only for burns. Yes, dimensions of lesions are used to determine injury severity. Question 6. In an adult, 100% blood volume is considered approximately how many cc? 3,000 cubic centimeters, 4,000 cubic centimeters, 5,000 cubic centimeters, 6,000 cubic centimeters. 5,000 cubic centimeters. Question 7. The severity of codes in ACE are not age-adjusted in some categories. True, false, only for head injuries, only for thoracic injuries. False. They are age-adjusted in some categories. Question 8. Fractures may be best described in what type of report? Nursing notes, operative report, radiology report, discharge summary. Radiology reports best describe fractures. Question 9. Organ injuries may best be described in what type of report? Face sheet, radiology report, operative report, autopsy only. Operative reports best describe organ injuries. Question 10. Can patient or bystander reports of loss of consciousness, LOC, be used for coding purposes? Yes, always. Yes, if documented by a nurse. No, only if the patient is an adult. No. Patient or bystander reports of LOC cannot be used. Question 11. Which type of report is highest on the ranking of most reliable sources of injury information? Operative report, M.E/autopsy reports, radiology report, ed record. M.E/autopsy reports are the highest on the ranking of reliability. Question 12. Which of the following lists the types of hospital/medical record reports from highest to lowest rank in reliability of injury information? 1. Autopsy 2, operative 3, radiology 4, nursing/ICU 5, MD progress notes 6, ed record 7, D/C summary 8, face sheet. 1. Operative 2, autopsy 3, ed record 4, radiology 5, MD progress notes 6, nursing/ICU 7, D/C summary 8, face sheet. 1. Radiology 2, autopsy 3, operative 4, MD progress notes 5, nursing/ICU 6, ed record 7, face sheet 8, D/C summary. 1. Autopsy 2, radiology 3, operative 4, ed record 5, MD progress notes 6, nursing/ICU 7, D/C summary 8, face sheet. 1. Autopsy 2, operative 3, radiology 4, nursing/ICU 5, MD progress notes 6, ed record 7, D/C summary 8, face sheet. Question 13. What is considered the least reliable source of injury information? Face sheet, ed record, patient, nursing notes. The patient is considered the least reliable source of injury information. Question 14. What are the 7 injury descriptions included in the ISS external body region? 1. Fracture 2, sprain 3, strain 4, dislocation 5, subluxation 6, tear 7, rupture. 1. Abrasion 2, contusion 3, laceration 4, avulsion 5, degloving 6, penetrating 7, burn. 1. Hemorrhage 2, hematoma 3, edema 4, swelling 5, contusion 6, laceration 7, burn. 1. Crush 2, amputation 3, decapitation 4, avulsion 5, laceration 6, burn 7, abrasion. 1. Abrasion 2, contusion 3, laceration 4, avulsion 5, degloving 6, penetrating 7, burn. Question 15. A rubbed or scraped area on skin or mucous membranes caused by contact with a rough surface that removes layers is known as what? Laceration, avulsion, contusion, abrasion. Abrasion. Question 16. Road rash and friction burns are considered what type of external injury? Avulsion, contusion, abrasion, laceration. Abrasion. Question 17. Black or blue marks resulting from blunt force causing tiny underlying blood vessels to burst and leak into skin but do not cause a break in the skin are known as what? Abrasions, contusions, lacerations, avulsions. Contusions. Question 18. Ecchymosis, subcutaneous hematoma, bruise, and bump are all considered what type of external injury? Abrasions, lacerations, degloving, contusions. Contusions. Question 19. Tearing or ripping apart of tissues from blunt or penetrating force is known as what type of injury? Contusion, laceration, abrasion, hematoma. Laceration. Question 20. Ripping or tearing away of all layers of skin in which a portion is separated from underlying tissues, often creating a flap, is known as what type of injury? Laceration, avulsion, contusion, abrasion. Avulsion. Question 21. Traumatic removal of skin and SQ tissue separating tissue planes from their blood supply, especially from a limb, is known as what type of injury? Laceration, avulsion, degloving, amputation. Degloving. Question 22. Degloving injuries may be open or closed. True, false, only open, only closed. True, degloving injuries may be open or closed. Question 23. Which are typically more extensive, degloving or avulsion? Avulsion, degloving. They are the same. Depends on the patient's age. Degloving is typically more extensive.